Here's the real picture of staff shortage in the NHS. Emails and texts posted on the internet that appear to show hospitals begging their doctors to work extra to cover long lists of empty shifts. All emphasise how urgently doctors are needed. One reads, "We're that desperate."
For example,
it's all too familiar to Animesh Singh. Sometimes he works 13-hour overnight shifts with only half the doctors there should be.
You wouldn't fly a plane with only 50% of the crew, you're steering the hospital through a 13-hour period, and you're working at such an intensity that you're left burnt out by the end of that period of time.
If hospitals can't get their own staff to fill a gap, temping agencies will be asked to provide a locum doctor. So to get a snapshot of the situation, we asked England's hospitals for data from 1 week in February 2015 and the same week in February this year. The 16 trusts that could provide figures reported they'd filled 18% more shifts with agency locum doctors this year, and 49% more shifts were unfilled in the week in 2016 compared to 12 months before. To drive down the spiralling cost of locum doctors, the government has imposed a cap on how much agency staff can be paid per shift. It has saved the NHS almost £300 million since October, but there is also clear evidence that it's making it much tougher for hospitals to fill their staffing gaps.
It's harder to fill shifts than it was.
A survey of temping agencies reveals locum doctors prefer to work for the private sector than accept the new NHS pay rates.
The locum doctors, the temporary nurses are actually getting half the pay that they were getting this time last year. So it's no wonder that people, if they're getting approached to fill a shift in the middle of the night or on a bank holiday, are perhaps having second thoughts about it.
The Department of Health says there are already over 9,500 additional doctors caring for patients since 2010. But this isn't just about numbers. It's also crucial to have the right mix of skills and resources available. Using a different mix of skills is one way that this East London Trust has found to plug its gaps.
There are some significant risks in the future in relation to the ability to make sure that we have the right workforce with the right skills to look after the patients and their needs. So one of the things that we're looking at is new roles. So we're appointing some doctor's assistant roles and some pharmacists that will be working in A&E.
However, our research suggests that for many hospitals, finding enough doctors is a daily struggle, and that only creates greater pressure for the staff who are there, delivering care to patients. Catherine Jones, 5 News.